All right. Well, I'm here with my good friend, Dr. John Hickey from Boise. And he's one of my doctors, many chiropractors that I've had, but he was my chiropractor when I was living in Idaho. Awesome young man. And I've known him for several years now. We've been to all kinds of conferences together, on trips together. And we're just both really passionate about making sure that people are able to optimize their health using the right tools, using the best tools. And John and I got to know each other through NeoLife. Basically, both of us being involved in this nutritional research organization, and we've incorporated both of us into our own businesses. And John, particularly in his chiropractic practice in Boise that he recently took over from his dad, who's also an experienced chiropractor and does a lot of the same. So I'll let you share a little bit about both you and your dad and how you've incorporated it, John. But I'd love to know, first of all, what is your story with nutrition and health, and how did NeoLife play a pivotal role in what you were going through?
Yeah, awesome. Great question. So like Cameron said, my name is Dr. John Hickey. I'm a chiropractor. I also have a certificate in clinical nutrition. In Idaho, we take an extra course of, basically an extra course to get certified so we can do different types of clinical nutrition. So my health journey began when I was about 12 years old. I found out I was allergic to gluten. And that was actually after a couple of years of sickness. My body actually quit growing. I had health issues. And so after I got off gluten, I was really inspired by one of my doctors to go into the healthcare profession. And I chose chiropractic because my dad's a chiropractor, so it naturally blended in with the family. But I was actually not wanting to get into medicine. I was wanting to get into more natural health and healing. And chiropractic has been the avenue for me to be able to do that. So especially with the education that we understand the body more holistically and that kind of thing. So that's been my health journey. And prior to where I'm at now, in my 20s, I was exposed to a black mold toxicity in my apartment in college, and that really wreaked havoc on my health. So what that led to was actually severe adrenal fatigue. And for years, I had this chronic fatigue. I'm this 23, 24, 25-year-old, and I didn't have energy to get out of bed. Chiropractic school was really demanding and draining. And after, let's say, the first 2 to 3 months, it was really challenging for me to even get out of bed to go to class. So what I did is I called up my dad, who at the time was a chiropractor. He just retired a year ago. He has done a lot with different stuff. He's actually a naturopath as well. So he got me on some professional supply, and I believe it was a combination of Standard Process, Metagenics, Thorne. It was kind of all the ones in the chiropractic world that they do the conferences, the seminars, the stuff that a lot is really popular in that world. And I got on those products, and I think I did it for about a month or two, and I really didn't notice a whole lot of. I noticed a little bit of benefits, right? Some of those are good products, but I didn't notice a whole lot of benefits. I switched over to NeoLife after going to a workshop, and I was like, you know what? I'm just gonna try a different brand, different company. So I got on their products, and within a couple of weeks, I felt significantly better. My energy levels went way up, and I actually had this more sustained energy, and that's what actually made me look into like the true value of what nutrition is, and it's cellular nutrition. I'm sure Cameron's probably talked about it. So instead of like helping my body try to heal with some of these herbs and tinctures and different things that was not actually supporting my core, I got into core cellular nutrition, and that's how it's helped my body heal and thrive over the last, it's been probably 7 years since I started NeoLife. And since then, I've been able to really repair my immune system. It's been a long journey. And over the course of the last 6 months, I've actually gone through a complete physical transformation, lost some fat percentage, and now I'm building some muscle. And so I'm still using NeoLife for that as well. And so that's how I've ended up where I'm at right now. So NeoLife has played a pivotal role in a number of different things throughout my life. And right now it's helping serve me by putting on muscle and giving me the energy to do that. So that's how what NeoLife means to me, and that's how it's helped me get to where I'm at.
Wow, that's awesome. Yeah, it's similar to me. When I was in college, I was just chronically fatigued, and I didn't realize that was onset during high school. Like once I thought back about it, but I didn't know that was a condition, whether that was what was going on. And then once I got like a diagnosis of onset chronic fatigue, it was challenging because I'm like, man, I'm 21 years old. What am I going to do? And same thing as you. I went to a workshop and I didn't even hear anything about the product specifically, but I heard you need all 22 amino acids. Your body, you need to start with making your cells healthy, not just one area of your body. And it's more than just like juicing fresh fruits and vegetables and eating, an apple a day, which I was doing. And it wasn't making a difference. And so really it was at the root cause, it was a hormone deficiency, right? Which is cellular nutrition, because your cells produce those, and the same nutrients that make them permeable help with that. So it just totally turned my life around. Honestly, overnight, the 22 amino acids, I felt like I had amazing energy the next day. And, similar to you, improved my hormones over time, no more adrenal fatigue, and no more, honestly, no more recurring sickness as well. My immune system has just been rock solid. If something happens, it's very short lived, because we know that, hey, if it's a fever, our body's fighting something, we can support that and we can really improve. So similar to you, that just led me into, telling more and more people about it, and getting some nutritional certification so that I could really pursue this as well. And, I just want to actually switch and ask you, why are you so excited about the world of natural health and particularly nutrition and supplementation, not only as a doctor, but just in general as a young person? Like, with everything that we see happening, we could easily be dismayed. And there's kind of like a one size fits all in many regards in medicine. But what are your thoughts on just the future when we look at holistic health and the interest and the energy that's behind that?
Yeah, great question. The reason why I'm so passionate and excited about holistic health is because it's the foundation, and it's just the simple way to do things. You go into pharmaceutical world, things are so complicated. They've got a drug for this thing and that thing. And then you go into, like, there's so many different factors and things, but when you get back to the core, and these are actually my personal 4 beliefs for physical health. Number 1, taking care of your spine and nervous system, spinal health. Number 2, movement, making sure you get exercise, making sure you get movement, making sure you're stretching, moving your body, activity, nutrition. And then the last one is stress management. And so those 4 core, and in my practice, if I have patients who are getting adjusted regularly, exercising regularly, and eating well, taking supplements to fill the gaps, they end up having so much better results. And so once you focus on, and even 3 of the 4 areas, you focus on those, and you're going to have fantastic results. I try to focus on all 4 of those every day, and that's what helps me stay healthy. And ultimately, in terms of like how this is so holistic, that it's just, those are the simplest 4 things. It's like ancient wisdom that now holistic is no longer like this, out there factor, all this different stuff. It's just what we should be doing. We should be walking. We should be nourishing our bodies. We should be making sure that we diminish our stress and that kind of stuff. And our bodies heal. They're healthy. That's how we promote health. So that's just the core.
Yeah. And I think it's just intrinsic and natural to when we really just start to apply critical thinking and consider, okay, my health is really in my hands. It's in my control. It's not something that happens to me, but it's something that I make decisions about and then I act on every day. It becomes a lot easier, and it becomes a lot more common sense. We don't have to think about all the side effects that can happen. We just think about, oh man, I might be trying to deal with one issue, but I'm getting so many side benefits when I improve my spinal health or when I improve my nutrition. Those things are all interrelated and they're synergistic. And so with that, that I want to pivot to specifically with the nutrition. What we do and what we recommend is synergistic, right? And first of all, I don't know anybody, even people that don't work specifically as a health practitioner, but there's obviously a ton of people that you and I work with that have their own businesses with NeoLife that also just teach people about holistic health and different things that they can be doing. And so, it's never just about supplementation. However, when people are really struggling or when they're really deficient, and I think people don't realize how deficient they are nowadays, because we just kind of assume, oh, I can start doing a little bit of juicing, or I can start eating those things. And those things are all great. But, you and I have both learned that the nutritional value of the food, even organic and stuff, has declined dramatically. And you're still getting some pesticides and things like that have some negative side effects. And of course, if people are being sedentary, or if they're taking a lot of pharmaceutical drugs or things like that, they're experiencing a lot of well-known side effects. And so just like if they're not managing their stress or they're not sleeping enough. And so, what would you say as far as the role of, your dad kind of coined the term that many of us are using now, which is totally accurate, of concentrated nutrition or concentrated nutrients. Can you tell me the role of that particular thing in helping people that maybe you adjusted them, or they have changed their diet a little bit or something like that, and really making a huge turn? And where do you see that as far as one of the tools in your tool chest? Like, where would you put it as far as how important it is to supplement?
Yeah, that's a great question. I would say a lot of people are already supplementing. I think some of the studies show that 75% of people take supplements. And there's a difference between supplements and concentrated nutrients, right? Supplements, that might be, let's say it's multi-minerals, right? Minerals are fantastic for the body. It's part of what you see. It's super important, right? But are they concentrated nutrients that our body can actually absorb? So there's just different ways to approach that. And so I think that the concentrated nutrients, the NeoLife products, they really get in, and they're so useful for the body. There's a science, I'm sure Cameron's probably talked about that, but that's something that can be really helpful. And I find that when patients are on those consistently, right, our bodies heal in rhythm and routine and through consistency, just like chiropractic care. If someone has an injury, I see them for a certain number of times so we can get their body healing and functioning well. And then oftentimes a lot of patients come back about once a month. So with that, we can get patients on this monthly protocol, and that they're used to getting adjusted once a month. So they take their supplements, they get them every month, and they take their vitamins every day, and that's part of their routine. And I talk about lifestyle. So I've got patients going on morning walks. I got them doing corrective exercises. So I'd have a program that for 5 minutes in the morning, they're stabilizing their neck, they're increasing their thoracic mobility, they're getting their core active, engaged. And so it's like part of these are these routines that when we add all these things together, it gives people the best chance at health and the best opportunity for success. So to me, it's one of the pieces of the puzzle. And if you remove that, then it's like things start to break down. People start to feel sick, start to feel loss of energy. And if we just incorporate that in their day, it's so simple. And then they're feeling better and they get better results across the board from everything. So it all just piles up, and it's all trending towards that truly health and holistic wellness.
Yeah. And by saying holistic or synergistic, we mean that there's things that they work together, and they only work together, like as they're designed to work and as they actually work out, they work together. You have to do them in tandem. Now, you and I are passionate about not just supplementing, but eating really healthy and eating clean and eating pure. And that can be adapted, right? You can do, I think probably you and I are similar in that we like to do a lot of healthy plants, and then we, organic stuff, getting a lot of protein, maybe less carbs and less sugar. Where do you see the importance of supplementation, considering that the nutritional value of the food has gone down, and then sometimes people are just at this point, and maybe even ongoing, where it's going to be more effective for them to make sure that they're getting a concentrated amount of those nutrients that, like, for example, whole grains, right? People aren't their lifestyles don't really justify eating the amount of whole grains that we need to get those important nutrients from the whole grains that aren't even in most whole grain products. So one of the completely unique supplements that we have with NeoLife that's really helped is those healthy fats, lipids, and sterols that are in the whole grains, and so where do you see the role of supplementation? Like, if you're a young person and you're thinking, okay, how do I budget? How do I look at, food intake and then supplementation? Where do you see the role as making that like an ongoing regular part of your day, rather than just something that you're going to do, medicinally, so to speak?
Yeah, that's a great question. Oftentimes when people have the symptom, it's already, things are so far along, right? When someone comes into me with, let's say, neck pain, do the exam, they've already had some neck dysfunction before the pain started. So a lot of times with disease, and specific chronic disease, people don't just get cancer, heart disease, diabetes. That's that process that started years and years before. So part of it is like educating people to like, hey, you need this so much sooner before you think you do. And then sometimes people will come in, they're like, oh, I've been feeling sick, I've been feeling bloated, my digestive system, skin, blah, 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 you name it, all these symptoms. Well, that's the point where there's actually a problem, and now you're trying to fix it with nutrition, with lifestyle, with a whole bunch of different things. And that's almost like that therapeutic dose. But if we just maintain health and keep that part of our lifestyle, then we don't have to like get to that point where we're going to have to throw a bunch of stuff at it. So prevention is the key here. So
Yeah.
that's how what I'd say for that. Yeah.
Yeah. And then in your life, in your practice, because you're really just teaching patients to do what you do, and I know that because I follow you and I've been friends with you for a while. You don't just, snap and crack people and tell them to take all these products, but you're actually doing those things and incorporating yourself and showing other people that. So, there's a point at which if you have an issue, it might be good to, like you said, do therapeutic dose. I've had a few injuries, or there's been times where, I needed to really boost my immune system. We did that a lot at the beginning of the pandemic, so we didn't really know what to expect, or you're on a journey to build more muscle. So there's times where you increase more, but would you say that it's always important to really look at a core foundation? And do you use that yourself, and do you apply that to your patients?
Yeah. Yeah. I'd say the core foundation kind of goes back to the same concept of the cellular nutrition, right? So every cell in our body has this little fatty layer. It's the double bilipid phospho. I forget the name, but anyway, that layer on the outside, right? So that's the core. That's what energy and nutrients can go in and out of the cell. And then there's a little immune system around every cell, and then there's a little antioxidant system. And then there's the actual nutrients that go into the cell. So that's the foundation. And when like the first class I took at school was cell biology. And it was like the first thing we learned about was the outside of the cell and how that works. And then we go into tissue, and then we go into organs, and then organ systems, and then the body. And so that's how everything builds. And so the foundation is that cell. So that's why when I give certain supplements to a patient who has an injury, right? What we have to do is we have to actually repair some of that tissue. And how do we do that? We start to feed and nourish the cells, and that's the foundation. So if you're constantly checking in and making sure your foundation is good, then the rest of your body is going to be good. But if you're not, then that's when we end up having all these other issues down the road. So foundation, super important. And I think the big thing is just understanding how to communicate that. And I know, it's like you ask people, hey, what are your thoughts on nutrition? Do you know about nutrition? Yeah. And it's very vague. And the answers are people think that they should be eating and drinking a certain way and do that kind of stuff. But it ultimately comes down to what's the core value. And that's the foundation. And without getting too far into talking about the cell, that to me, that's what's really important. Yeah. Then with that, it's just amazing how when you give someone the concentrated nutrients, the supplements, feed the cells, make those cells healthy. And it's different over time, right? You're repairing cells. So it's it might be up to 90 days before people start feeling different. Some people who are younger, who have a more potential to feel better, because their bodies aren't so screwed up, they might end up feeling better quicker. But it is one of those things that I got patients, who've been taking the same stuff for years, and they're doing great. And
that's the goal, right? The goal is, what I've really enjoyed and what I'm noticing in a lot of particularly young chiropractors is getting their patients well. And by doing that, they continue to have a lot of patients come in because it's word of mouth. But the goal is to fix and address the issue. And then, there's routine care. For me, it's once to maybe twice a month, depending on the type of activities that I'm doing or something like that. Or maybe you can stress that I would see a chiropractor for routine care. Just I go to the dentist, maybe I'm looking at maybe once a year, not every 6 months, because I take really good care of my mouth. And after 7 years, I went to the dentist, and I hadn't been for 7 years. I knew a lot about oral care, but I needed to go check in, and I had no cavities. I had no decay, which they were just totally blown away by. And it's a variety of things. It's good oral care, and it's also good nutrition and avoiding other bad things. But all that to say is, you work on getting patients well, and you use nutrition that way. But it's what you're saying is there's also an importance of consistency, and there's not ever going to be a time that people aren't going to need to think about their spinal care, that they're going to have to think about stress management, or they're going to have to think about nutrition, because our bodies use it every day, particularly things like protein and vitamin C. A lot of people be like, oh yeah, I take vitamin C, but your body replenishes that every 24 hours. You have to be getting new stuff in. And so that's a great point. I want to pivot to ask you two more questions. The first one is, what are your favorite things that you like to use in your practice and personally? What products do you like the most? And what things about those products are unique to what NeoLife provides?
Yes, great question. So my favorite product, it's actually a group of products. They call it the breakfast pack because it's designed to basically, the breakfast pack means that you can take it every day. You can have the shake for breakfast along with a little packet of vitamins. To me, that gives you your core nutrients, amino acids, everything you need on a daily basis from the protein, and then a little packet of vitamins. And I think I happen to have one right here. So wasn't planning on having one right here, but we'll talk about it. So this is the core, this is the Pro Vitality Pack. This is core nutrition. And then the shake. So those combined is probably my favorite product, especially because it's so simple, right?
Five products, but it's designed and packaged to really just be two products, right?
Yep.
And to replace a meal.
Yep. Simple and easy to use. It's also really good to build that habit. And the amazing thing is, like, I don't have to figure out these individual supplement protocols for every individual patient. I would say like 75% of patients just get the breakfast pack. And if they can't afford the breakfast pack, then we just throw them on Pro Vitality Pack. This gets delivered to your door for about $50. And patients love that. And so it's one of those things that we can keep that consistently. And for me, as like as having a busy practice, I don't want to sit down and have every individual person have an individualized plan unless they're coming to me for that. We can just add that good quality nutrition, and then you can train the staff, and the staff can just sign people up. It's just easy to put them on that plan. And then I have some patients that come to me once a month. I have some that just come as needed. And so if they don't want to have to drive across town to come get their supplements, we just have NeoLife fulfill that, and it just ships it to them. So in terms of a practice, it is like, I didn't go to school to be able to sell supplements, but it is that extra side benefit, extra bonus. But on top of it, you're actually adding more value to people's lives, and they're getting healthier. So to me, that is that's kind of going into the core product. So that is basically the core product. In terms of like clinical practice with, let's call musculoskeletal, the products I love most, the calcium magnesium with vitamin D, that one has been incredible for my older female population. Osteoporosis, osteopenia is huge in women that are over like 55. I've had a couple patients who've actually gotten on calcium magnesium, and they've reversed their osteoporosis, and which is incredibly difficult to do, especially in the medical world. So those are some fantastic findings. There's a product called Full Motion. A lot of times, especially working with joints other than the spine, shoulders, knees, different areas, carpal tunnel, taking the Full Motion has been phenomenal for my patients. I have one of my patients, he's 20, maybe 25, 27 range. Has really bad knees. So we got him on Full Motion for about 3 months, and he's been able to play basketball, and his knees are doing so much better. And then the last one for musculoskeletal care, salmon oil, Full Motion, calcium, magnesium, those three are phenomenal. And you put patients on them for about a month, and they're going to notice some really significant results. Salmon oil is just good across the board, but for inflammation, healing, lowering, it's like kind of almost like that natural pain relief that a lot of people are taking NSAIDs, and they're taking Advil, that kind of stuff. So those three for the chiropractic practice, musculoskeletal care, physical therapy, massage therapy, because people are coming in with aches and pains. Those ones can be really helpful to help the body heal, especially going back to like the core, right? Extra salmon oil, fantastic. So those three are more targeted for my practice, but in general, breakfast pack for just overall health and wellness.
Yeah, we won't go into, but there's other tools that we have that are pretty unique too, as far as helping people with lipid mobilization for reducing fat, building muscle, high quality protein, but not just protein, all the amino acids, getting people all the nutrients, antioxidants that they need. But you bring up salmon oil, and just to we could say this about full motion. We could say this about the NeoLife shake, which is in the breakfast pack because of all the clinical studies. But why I love that product so much and why it works so well in your practice, right, is because this isn't something that just is your and I's opinion that it's great. It's actually clinically proven to reduce inflammation dramatically and stuff. So the last question that I wanted to ask you is, why would you, as a chiropractor, say that this is extremely important to incorporate into your business, not just to help patients, but to help you with your long-term financial goals and business goals?
That's a great question. And I'm actually learning the value of that right now. My dad got into, he has sold supplements in his practice for his entire career. He got into NeoLife about 5 years ago, and he was able to retire with an additional, just in 5 years, he was able to retire with, I think he makes $2,000 to $3,000 a month of retirement income just off of supplements from his previous patients, right? So
residually makes that.
Residually, yep, every month. And so to me, it's like, okay, well, if I start that at the beginning of my career and do that similar process, just get patients on there, and I don't have to work extremely hard and like just hustle to do this. This is just things that patients are already going to be consuming. We switch them over, we get them on, they have a good result, and they stay with it. So for me, over the course of my career, I'm going to be able to retire with a lot more residual income than he did. And so I see it more as a long-term benefit. So he sold his practice to me. So I'm paying him for the patient base, the practice, all that stuff, but he is taking all the supplement sales from his current or previous patient base with him. And now I get to build that up as well. So that's something that, like, especially as a small business owner, entrepreneur, it's like, I don't have a company or no one else is funding my 401k. So I'm using this as one more avenue, one more income stream, so that down the road, I can make that residual income. And, there is definitely a lot of opportunity. Everything in this is scalable, right? So I have a couple of friends that are in the business. I have a friend of mine, he's a functional medicine pharmacist. He actually works as a retail pharmacist, but he went into functional medicine. So he's working with NeoLife and his patients. So everything I can do, I can scale that, and I can work with other healthcare practitioners. But at the same time, if I don't want to do that, and all I want to do is I don't have to worry about the business side and all that stuff. If all I want to do is just work and just offer these products, over time, things will add up. And then now, I could see myself a year or two from now, making an extra $2,000 to $3,000, an extra, let's say 10, 20 years from now, that could be double, triple, that kind of thing. So definitely long-term benefit. And it's just kind of like having the habits of consistently sharing, consistently using the product. As long as I'm using the product, it's easy for me to share. And then patients are always asking about other things they can do at home, whether it's stretches, whether it's icing, heating, but taking care of your nutrition and supplementing is also one of those tools. So that's been helpful for me. And it's also been incredibly helpful for my patients. And then you get a little reward, a little extra income from that as well. So.
Yeah. Awesome. Well, man,
Great.
it's so good hearing from you. I'm so glad that it's making a difference in the lives of your patients and other people. And I'm so excited for other practitioners to get on board with that. We'll include a quick testimonial from his dad on why NeoLife is better than everything else he's tried, even all those really high-end brands that are typical in that world. And if you want to follow John Hickey, where can people follow you?
Great. Yeah. So I'm on Instagram at It's Dr. John, all lowercase, all one word. That's going to be the best way to follow me on social media. So
I recommend you do that. He puts out great stuff. Awesome,
hey.
John. Well, I'll see you at the next NeoLife convention or the next event or next summer in Boise, man. You have a wonderful day. Thanks for your time.
Good. Take care.